Hey Pathlight community, today is Thursday, April 9th, 2020. Ruth Banta here. Today we were notified that a staff member has tested positive for COVID-19. She has not been working in any of our sites since March 16th. We are following DDS and public health protocols. This brings the total number of people in the Pathlight community who have tested positive for COVID-19 to 4. On Monday, I shared with you that the Centers for Disease Control issued guidance that everyone should wear cloth face coverings when they are out in the community. They recommend this to protect the people around you if you are infected but not showing symptoms. Cloth face coverings are different than medical grade personal protective equipment. As always, the health and safety of the individuals we serve, their families, our staff, our care providers, and the Pathlight community is our primary concern. We are working around the clock to distribute cloth face coverings to all of our staff who are providing direct care and to obtain medical grade personal protective equipment. Our staff are working daily with various vendors and placing orders. We are also working cooperatively with other providers to purchase bulk orders of PPE. We started distributing cloth face coverings this week. By the end of this week, we will have distributed 160 cloth face coverings to staff. We are expecting 300 more next week, which we will also distribute. The Pathlight Personal Protective Equipment Task Force is comprised of clinical staff from throughout the Pathlight organization. They are putting together protocols on how we deploy our PPE. The cloth face coverings are being distributed as fast as we can obtain them to direct care staff who are working with our most vulnerable individuals and houses. Our goal is to provide them to all staff. Medical grade PPE is in short supply nationwide. We are doing our best to ensure we have what is needed when staff and care providers need to care for an individual who is showing COVID-like symptoms or has tested positive. The old adage that prevention is the best medicine applies here. Continuing the practices of good hygiene and social distancing is as important as securing PPE so that we minimize exposure. Please keep up your efforts and even increase your vigilance over the next few weeks. Gracias. Sigan con su buen trabajo, que está bien, y lávense las manos. Thank you. Keep up the good work. Be well and wash your hands.